The root reason why treatment of swelling and urine protein is ineffective and the symptoms are repetitive is that there exists large-scale lesions in kidney blood capillary and various intrinsic cells. The cause for lesions is the accumulation of large quantities of inflammatory factors in kidneys, and the large quantities of inflammatory factors are caused by the large amount of toxins accumulated within human body's kidney blood capillary. The accumulation of inflammatory factors around the toxins is to eliminate those toxins through inflammatory reactions. However, the quantity of toxins is so large, it leads to excessive inflammatory reactions, resulting that the toxins are not eliminated. On the contrary, the kidney's intrinsic cells and blood capillary are suffering damage. In this moment, large quantities of blood and protein are leaking out. This is the reason for swelling and urine protein generation. The reason for this incurable and long-treated disease is that this inflammatory factor is not coming from outside bacteria or viruses, but from human body's own toxins, as well as the excessive accumulated nutrient substances. That is to say, human body needs to generate inflammatory factors for eliminating these toxins. This kind of immune inflammatory response is called human body own inflammatory response, also known as oxidative stress response.
Hello friend, here is the nephrologist on the video consultation of Peking Tung Shin Tang Hospital Traditional Chinese Medicine. I'm the host, and today we are lucky to have Professor Mao Yar joining us. Okay, welcome Professor Mao Yar.
嗨，大家好。今天呢，我们主要讲的题目是呢，糖尿病肾病是个什么病？
Hello everyone, and today we will mainly talk about what is the diabetic nephropathy.
首先呢，我们要了解糖尿病肾病是个什么病，因为糖尿病呢是人体内外毒素导致的血糖升高，损伤肾脏固有细胞。临床表现为呢尿蛋白水肿、血压升高、血肌酐升高等临床一系列的症状，也就是糖尿病肾病的并发症。
First of all, we need to understand what is the disease of diabetic nephropathy. Diabetic nephropathy is a diabetic complication in which the toxin in the human body cause an increase in the blood sugar, which damages the innate cell of the kidney. And the clinical manifestations are symptoms such as urinary protein, edema, elevated blood pressure, and also the elevated serum creatinine.
根据呢国际糖尿病联盟的，就是2013年最新统计，全球糖尿病在20岁到79岁成年人中的发病率为8.3%，这个患者呢已经达到了3.8亿人。其中呢80%的在中等和低等收入的国家，并且呢在这些国家呢呈快速上升的趋势。估计呢到2035年，全球呢将近有5.92亿人能患糖尿病。全球共有510万人死于糖尿病肾病和相关的疾病。所占的死亡人数呢为8.39%。糖尿病肾病是糖尿病病人中最重要的合并症之一。中国的发病率呢也呈上升的趋势，目前呢已成为中末期肾脏病的第2位的原因，其次呢仅次于各类肾小球肾炎。由于存在复杂的代谢紊乱，一旦发展到中末期的肾脏病，往往比其他肾脏病的治疗更加棘手。
According to the latest statistics from the International Diabetic Federation in 2013, the global prevalence of diabetes in adults aged 20 to 79 is 8.3%, and the number of patients has reached 382 million, of which 80% are in the middle and low-income countries, and showing the rapid upward trend. It is estimated that nearly 592 million people worldwide will have the diabetes by 2035. A total of 5.1 million people worldwide will die of the diabetes-related disease, accounting for 8.3% of all deaths. Diabetic nephropathy is one of the most important complications of diabetic patients. The incidence rate in China is also on the rise. It has become the second leading cause of end-stage renal disease, second only to various glomerulonephritis. Due to the complex metabolic disorder, once the disease developed into the end-stage renal disease, it will become even often and more difficult to treat than other kind of kidney disease.
这个主要表现呢为尿蛋白、水肿、血压升高、血肌酐升高等症状，其中呢血糖控制不稳，反反复复的大量的蛋白尿，血压过早的升高和肾功能过早的下降是糖尿病肾病预后不好的主要的指征。
Mainly manifested symptoms are universal protein, the edema, elevated blood pressure, and also the elevated serum creatinine, insufficient glycemic control, recurrent large amount of urine protein, and also high blood pressure and early renal function decline are all the main indications for a poor prognosis of diabetic nephropathy.
那尿蛋白呢、水肿呢、血压升高呢、血肌酐升高等是引起的，是什么引起的呢？就是说糖尿病导致人体的代谢异常，脂肪细胞的堆积、凋亡引起过度，致使呢人体细胞的抗炎和自炎的平衡呢不断向自然方向偏移，肿瘤坏死因子呢、白介素6等自炎因子呢不断的释放和增加，损伤肾脏固有细胞，血浆蛋白呢漏到尿液里边，形成了尿蛋白，出现水肿、高血压、肾功能下降等临床表现，也就发生了糖尿病肾病。
What is the causation of urine protein, edema, elevated blood pressure, elevated serum creatinine? Diabetes causes abnormal metabolism, accumulation of fat cells, and excessive apoptosis, causing the anti-inflammatory and inflammation balance of human cells to shift to inflammation. Increase the release of inflammatory factors such as tumor, necrosis factor, and also the interleukin 6 related to the damage of the kidney's innate cells. Leakage of plasma protein into the urine and urinary protein, which clinically manifestation will be edema, hypertension, and also the decreased renal function, and this will be the diabetic nephropathy.
中医认为呢，糖尿病肾病主要是呢气阴两虚，病久及肾，气虚呢不能化水煮水则生湿，阴虚呢生热炼血，也就是气虚不能行血，则生淤血，湿瘀互结，发展到自身自重的状态。这个湿毒呢、淤毒呢相互交结在一起，便生成肾毒，损伤肾络，最终呢那个脾肾呢俱伤，不能固精，摄精。所以来讲呢，精微的物质呢就会流失于尿液中，就出现了尿中泡沫增多等临床症状。
Chinese medicine believes that the diabetic nephropathy is mainly caused by the qi and yin deficiency. Long illness damages the kidney. Qi deficiency leads to damper water. Yin deficiency raises the height. Qi deficiency, like blood circulation, and the blood stasis will occur, and this will develop to a state of extreme, and the white poisons will become the kidney toxicity, and lead to the damage to the kidney. In the end, the spleen and also the kidney are damaged, and the fine substances is lost in the urine, and the clinical symptoms of increased foam in the urine will start to appear.
好的，各位朋友，所以说我们今天给大家呢讲的糖尿病肾病是个什么病？知道诊断后，那为什么会得糖尿病肾病呢？明天的直播课程，我们再给各位朋友进行详细的讲解。因为只有知道得了病的病因，才有办法进行治疗。所以呢，为什么会得糖尿病肾病，是治疗糖尿病肾病的关键。
Okay, my friends, this is what what is the disease of diabetic nephropathy, and we are talking about it today. After knowing the diagnosis, we can better understand how to treat the diabetic nephropathy. So tomorrow, we will continue the video consultation, and also we will explain in detail about how the diabetic nephropathy will be treated.
感谢朋友们的收看，下期再见。
Okay, thanks for everyone watching, and next time we will talk about it. See you next time. Okay, bye bye.